Hello everyone, good morning. Myself Ankit Rai. I am the final year B pharmacy student of Shivaji as only College of Pharmacy. Today I am presenting our articles regarding topic overview on Insitu floating drug delivery system under the guided by Assistant Professor Harshada Dekkar, Madam. So let's look out the introductions. So over the past 30 years, great attention has been focused on the development of control and sustained drug delivery system. The goal is design this system is to reduce the frequency of dosing or it increasing the effectiveness of the drug by localization at the site of the action, and it can be decreasing the dose required for providing the uniform drug delivery system. So basically the meaning of the in situ gel system is it is a system has been emerged as one of the best novel drug delivery system. The in situ gel system help for the sustain and controlling the releasing of drug and improve the patient compliances and comfort by its special characteristic feature of solution to gel transition. Basically, in situ gel system are at a liquid at a room temperature, but it can be undergoes when it's contact with a body fluid or change in the pH. It is a contrast to the very strong acids, and it can be easily applied in the liquid form to the site of the drug absorptions. The in situ drug delivery system have been used to deliver many of the drug like oral, ocular, rectal, vaginal, and injectable and parental route also. So there have been some advantage and disadvantage of in situ drug delivery system. So it can be easily to be drug administration, and it also be improving the local bioavailability. It also improving the patient compliances and comfort. But there is some disadvantage behind this in situ drug delivery system. First one is it required a high level of the fluid, and the solution from of the drug is more susceptibility for the degradation, and it can change the stability hormone due to the chemical degradation. Now look at the applicability of in situ gelling system. There is a various route of administration depending on their drug administered. In situ gel system may be classified in a five category. First one is the oral delivery, second one is the ocular delivery, third one is the nasal delivery, fourth one is the rectal and vaginal delivery, and last one is the injectable drug delivery system. Let's look at the one by one the different route system. First is the oral delivery system. So oral delivery system, there is a various type of the polymer has been used like a pectin, zyklogum, zelgum are the natural polymer used for the in situ forming of oral drug delivery system. The potential of the oral administration in situ gel pectin formulation for the sustain the delivery of the drug. The main advantage of this using pectin for this formulation is that it is a water soluble, and so organic solvent are not necessary in the formulation. In a in situ gel gelling formation as a vehicle for the oral delivery for the theophylline is reported. Ocular drug delivery system. So drug delivery system for the in situ gel basis ocular delivery system, natural polymers such as gel gum, alginic acid, zyklogum are the most common use for the polymer. Basically, local optimal drug you all of you seen it is a drug delivery has been used for the various compounds such as antimicrobial agent, anti-inflammatory agent, and autonomically drug used to relieve intraocular tension in glaucoma. So conventionally, delivery system often result is a poor ability and therapeutically response because high tear fluid turn over the dynamically and causes rapidly elimination of the drug from the eyes. So to overcome of this problem, we will use the in situ drug delivery system for the oculars. So the in situ forming the polymerically system were observed to show a significant meiotically response for a periodically of the 4 hours when installed or inside into the lower cardiac sac of the human eyes. The basically formation of this ocular delivery system to evaluation for the delivery system of optimally for the treatment of the uveitis also carried out. Next is the nasal drug delivery system. So basically nasal drug delivery system it is a use for the treatment of allergic rhinitis, and there is a natural polymer used like gel gum and the xanthan gum where we naturally polymer we have to use. We have already seen it at earlier. So there has been conducted one experiment on animals, and they studies that using the allergically rhythmic model and the effect of the in situ gel antigen induced the nasal symptom in sensitizing rat was observed. So in situ gel was found to be inhibiting the increasing in the nasal system as compared to the market formulation like Nas1X and fruital suspension. There is a various market formulation has been available for the nasal delivery. So for this reason, we have to be introducing the nasal drug delivery in situ gel system. Uh, Next one is a rectal and vaginal delivery system. So basically, it is an investigation that xylem-based thermally reversible gel. It means that xylem polymer is a thermal reversible for the rectal drug delivery, but it can be eligible for the vaginal delivery system. The in-situ gel also poses the potentially applicable application for the drug delivery for the rectal and vaginal route also. For the better therapeutically efficacy and patient compliances, mucoadhesive and thermosensitive prolonged release vaginal gel incorporately clotrimazole beta clotazistine complex was formulated for the treatment of the vaginitis. In additionally, in a rectal and vaginal drug delivery system, a significantly reducing of the drug was observed after the administration of an in-situ polymer system, thus is indicating the avoidance of the adverse effect of the indomethacin or nervous system. Next delivery system is injectable drug delivery system. Basically, it is a development of the injectable in-situ gel forming the drug delivery system has been received a considerable interesting over the last decade. A novel injectable thermostable in-situ gel, hydrogel, was developed by the treatment of the tumor. The hydrogel consists of drug-loaded glycan solution neutralizing with beta-glycerosphosphate. The local delivery of the pesticides for the formulation injectable intramolecular was an investigation using the EMT6 tumor implanted subcutaneously in albino mice was conducted. So now talk about our main topic is a floating oral in situ gel. The our topic is fully focused on the floating oral in situ drug system. In 1868, Davin first described the floating drug delivery system. Floating basically, what is the difference between the floating and in situ? So first, I will tell you the floating drug delivery system. Floating drug delivery system is an appropriate technology for extended the gastric residential time to improving the drug bioavailability. There are many physiologically function required to improving the gastrointestinal mechanism such as a small upper gastrointestinal absorption window, a limited half-life of the medicinal and drug toxicity in gastro tract environmental. These are the floating drug delivery system. Now we talk about a oral in situ gel forming system is also known as a stomach specific system. It has been providing a suitable way of providing the controlled drug delivery within the stomach with enhancing the gastro retention and slow the drug release also. So let's look at the mechanism. So let's look out the mechanism. Let's look at the mechanism of floating drug release system. So just look at it. The floating drug release system have a bulk density less than the gastric, and it is also so remaining floating in the stomach without affecting the gastric emptying rate of the prolonged period of the time. While the system in a floating of the gastric containing the drug is released slowly at a desirable rate from the system. After releasing of the drug, the residual system is eliminated from the stomach. This result it increasing the GRT and better control of the fluctuation in plasma drug concentration, and however it can also be maintaining the floating of the doses from the surface of the meal. There is a formula m by rho minus by F gravity, where is F is a total vertical force, dF is a fluid density, ds is a object density, v is a volume, and g is a acceleration due to the gravity. So now look at what are the factors which have been affecting our the floating in situ system. First one is physiologically and second one is biologically. So physiologically there is a size, shape and density, and for the biologically there has been some certain factor like age, gender, feed or unfeed state, feed frequency, nature of the meal, and concomitant drug administrations. For example, like the anticholinergic effect, efficacy of the GRDDS. What are the approaches for the in situ gel system? So there is so many approaches we have conducted. First one is the physiological stimulation. In that there is a temperature trigger in situ gel. It means that it is a commonly used catalyst in the environmentally active the polymer system in the in situ gel formulation. And pH trigger in situ gel. Due to the pH change in the complex is formed, pH sensitive and pH responsible polymer are used in this manner. Second one is the physically change in biomaterial. If we have a change in the physically in the in situ gel system, there has been increasing the prolong of the drug in the stomach. First is the swelling and diffusing. Swelling in that approach is the polymer absorb fluid from the surrounding environment and swallow and drug release slowly. In the diffusion process, the solvent from the polymer solution into the surrounding tissue lead to the precipitation of the polymer matrix like N-methyl pyridine. NMP was widely used for the shape of the polymer in situ gelling system. In a chemical reaction, we have also be increasing the prolonged time of the drug release system, like enzymatic cross reaction. Enzymatic cross reaction in the process gel produced by the crossing linkage with the gel presenting in the body fluid. The formation stimulating in situ by the natural enzyme has been now be studied extensively, but tend to be have certain advantage over the chemically and photochemically approaches. And second one is the ionic cross linkage. In a ionic cross linkage, it is a polymer they have been used in this process. The presence of the various ions such as sodium, potassium, calcium, and magnesium. Ion sensitivity polymer that undergoes phase conventionally. And last one is the photopolymerization. In a photopolymerization, like a electromagnetic radiation is used like a photopolymerization during in situ gel formation. There are many types of the polymer used for the floating oral in situ, like sodium aginated gum, pectin, xanthogum, alginic acid, glytons, hydroxypropyl methyl cellulose, and isopropyl acramide copolymer, PGAPLE block copolymers, and peroximer methyl cellulose, ethyl cellulose. There is a many type of the polymer which have been used in a in situ gel system, but mostly we have frequently used as a sodium aginated and pectin. Pectin, why we have used the pectin? Because it is ionically polysaturated, which mostly plant extracted from the cell wall, and pectin has a backbone of the residual of the divalent ion in the presence of such as a free calcium ion which bind the glycotric acid chain, and it is ready for the gel in aqueous solution. In a sodium aginated polymer, there is a present in a linear polysaturated derived from the brown seed wheat, consists mainly of a alginic acid, sodium, salt, mixture of the polaric acid. It is also composed of the residue of the beta D manoric acid and alpha L gluronic acid, joined by the forming of the 1,4 glycosidic bonding. And in a gelination, it is a diluted the sodium aginated solution occur when its contact with the stimulating gastric acids. So there has been some parameters of the evaluation for the floating in situ drug delivery system, like clarity. So in a clarity, the visualization inspection under black and background with assess of the clarity of formulation. Texture analyzing, in a texture analyzing for main indication of the syringe capacity for solution. The frameness consists of the cohesive of formulation may be determined using the texture analyzing, so that formulation can be easily administered in vivo. Third one is in vitro floating study. So in vitro floating study, the time between the introduction of the doses from the floating on the stimulating gastric acid and the time during the which doses from remaining floating will be measured. This time will be measured buying the some equipment which have been providing. So it's called as a total floating time. PS formulation. So in PS formulation, what we have evaluated, the formulation will be taken in a beaker and add 1 ml of the NOS drop wise with continuous stirring. Then PS is checked by using the pH meter. There is measuring of the viscosities. So many have the evaluation we have performed. So there is a many type of the market formulation are available. Example like for the oral, the drug is a beta methasone. Market formulation is a celestone. It is a used to treatment of the conditions such as allergic reaction, dermatological disease, endocrine disorder, gastrointestinal disease, and hematological disorder. For the nasal route, there has been drug is a flutocasin. Market formulation is a diflucan, and it is basically used to prevent the fungal infections. For ocular, the drug is available for the lidocaine. Market formulation is the actin. It is treatment for the eye surface anesthesia during the ophthalmologic procedure, which it means during the surgery of eyes, it can use as a anesthesia. For the rectal and vaginal route, the drug is a metronidazole, and market formulation is a metrogel vaginal. Basically, it is used to preventing the certain type of the bacterial infection which will occur at the site of the vaginal. For the parentally route, the drug is a doxycycline. Market formulation is a etidox. Basically it is a used to prevent adult gum disease like periodontitis. So now look at our conclusions. So basically conclusion is the primary necessity of the successful controlling releasing and can be focus on product on increasing the gastric residency time and patient compliances that floated in situ offer. Exploitation of the polymer in situ gel for controlling releasing of the various drug, providing the number of advantage over a conventionally dosage form. It can be continuously and prolonged releasing of the drug with a good stability and biocompatibility characteristic make the in situ gel dosage form reliable. It is a various natural and synthetic polymer produced in situ gel, and it can be potentially be used for the oral, ocular, transdermal, buccal, intraperitoneal, parental, injectable, rectal, and vaginal route also. They have a high scope for the research work on the in situ gel system in order to providing advanced technique in drug delivery system. These are the reference we have taken from that site for the researching our articles regarding the overview of the in situ floating drug delivery system. These are the reference. We are thankful to our President, Honorable Dr. Shivaji Rao Journalist Sir, Secretary, Honorable Dr. Geeta Khere Madam, and Principal Dr. Nitin Moire Sir for encouragement and guidance for efficient use of social media to spread our the knowledge. I hope all of you understand our topic today is a overview in situ gel system of floating drug delivery system. For making an informative video, please like and subscribe our channel for such informative videos. Thank you.